Hi everyone, I'm Lisa from Medela. What I'm going to talk to you about is the Calma feeding device. So first of all, just so you all can see what the Calma looks like, I'm going to pass it around. So my role is I actually look after New South Wales hospitals, and ideally we want to promote breastfeeding, and the Calma is a bottle that women can use once they've left the hospital and their breastfeeding is established, that they can continue to offer breastfeeds to the baby via the bottle, so mum can go out to the gym. Yep, come in. Mum can go out to the gym or can go to work or whatever, and someone else can offer to feed the baby and still be getting the express milk without the baby having problem going back to the breast again. So my name's Lisa. And I'll just pass around some breastfeeding booklets as well. Oh, someone will help me. Oh, and you can pass these around too. Thanks. All right, so what Medela offers is breastfeeding solutions. So the group exists to enhance the mother and the baby's health through giving life-giving benefits of breast milk. We understand that breast milk is so important. It's liquid gold. You know, we want to preserve and keep it going for as long as possible. So it's innovation inspired by Mother Nature. For nearly 50 years, Medela has been committed to the well-being and the health of mothers and their babies during breastfeeding. Nature provides us with an inspiring model. In close collaboration with the University of Western Australia, we are currently gaining a further understanding of the mother and the baby and turning the latest scientific knowledge into high-quality products. As the world's leading experts in breastfeeding, Medela's research-based solutions and products meet the high standards set by the hospitals, professionals, and by mothers, of course. This is the Symphony pump that most of you that, if you've had babies, will have seen the Symphony pump in hospital. And it's a double pump, so we encourage women to keep double pumping as well in the community, and obviously depending on their needs, whether they need to just pump a one-off time or whether they're going to be ongoing pumpers. So this is the Calma. You've all seen it. I've passed it around. So basically it comes in there's only one size for the actual teat, and there's not a separate one for a newborn to a 12-month-old. It's the same one consistently through. There's no fast flow, there's no slow flow. It's all based on the baby's own need. Will it just start? It's just a short movie.
Calma is a feeding solution that allows your baby to apply the feeding behaviour learned from breastfeeding and will help to prolong the duration of breastfeeding. Switching from breast to bottle and, most importantly, back to the breast again has never been easier. After a pumping session, the breast milk can easily and safely be stored in the bottle. The teat comes in one size that is suitable for the entire duration of breastfeeding. With the multi-lid, you can keep both your baby's next feed and the teat hygienically clean. Similar to breastfeeding, the milk only flows when the baby creates a vacuum. Calma consists of 3 parts, which are easily assembled and cleaned. The milk flows through the center. To equalize air pressure, Calma has an air venting system. The milk continues to flow, passing through this tiny hole. This prevents your baby from being flooded. Through the soft silicone teat, it finally reaches the baby, allowing him to feed in his own individual rhythm. With Calma, your baby can stay attached, pause and breathe. Switching between breast and bottle has never been easier.
So it really is amazing to actually see the Calma, because you can probably already know from seeing other babies, have a traditional bottle, that when you're holding the bottle upside down, that the milk drips out. And if the lid's too loose, the baby ends up wearing half the bottle and not even getting any, into their stomach. So the Calma is purely the baby mimicking what's happening on the breast. Oh. Sorry. How do I stop that now? Thank you. Okay, so with the new research, it's been identified that the vacuum does play the main key role in the milk removal. The tongue doesn't move into a marked peristaltic motion. There's no marked indentation on the nipple, and the tip of the nipple does not reach the junctation of the hard and the soft palate. So exactly as the baby would be doing on the breast is exactly the same mechanism it's doing on the Calma bottle. The breastfeeding friendly solution, again, the latest research proves with an up and down movement of the tongue, the baby controls the vacuum and hence the flow and the amount of milk that's coming through. So when the tongue's up, there's minimum vacuum and the milk is swallowed. And then when the tongue is down, the maximum vacuum and milk flow stimulated. So the baby will regulate its feed. For the first time, these findings are being implemented in this feeding solution. So Calma supports the baby to maintain the feeding behaviour that has already been learned at the breast. And when the baby feeds with the Calma, they can suck, swallow and breathe at their own pace, and that supports their stability into relaxed feeding. And especially designed for breast milk. It doesn't actually work effectively with formula, so we're only promoting breast milk. Again, the same sort of pictures that you've seen, the breast and the Calma, exactly the same mechanism of tongue movement. The advantages for the baby has to actually work to get the milk, similar to that on the breast. The vacuum is increased and decreased according to their need, and their facial muscles are trained. They suck, they swallow, they pause, they breathe in their own individual rhythm. The benefits of breast milk continue with the nutritional value, of course, with the nutrients and the vitamins, and they can switch back to the breast if they need to when mum comes home from work or back from the gym or wherever she's gone. And it continues to experience the close bond with the mother, and also that with the father when the father's feeding. For the mother, the advantages, use of the advantages of the world first, the baby retaining the learned feeding behaviour, sustaining a longer period of breastfeeding, child can go back to the breast again, supporting the well-being of the baby, drinking healthier breast milk for longer, and using a high-quality product based on the latest findings. It's the actual cap of the Calma is the first tip, and then the silicone teat, the top, the base, and the multi-lid. Over 500 babies helped in the development of the Calma, and the research took more than 3 years. So it's not something that was just formulated overnight, it was a long process. So it works with a milk flow that's regulated by the vacuum formed on the baby and by the milk flow control system. Oops. Going back one, can I? The air control system, the bottle is vented regardless of how tightly or loose you have the lid. The multi-lid's got the two functions to tightly seal the bottle and keep it clean while it's being carried, and the cap obviously protecting the tip. So with Medela, our breast pumps that we have, the swing maxi, the freestyle, they're all two-phase expression, and the harmony, which is a manual pump. They mimic the baby's natural sucking rhythm patterns to express more milk in less time. So the first phase is the stimulation phase, and the second phase is the expression phase. The Calma uniquely designed feeding solution for breast milk enables the baby to pause and breathe and regularly develop to maintain their naturally learned feeding behaviour. And
j'ai eu quand même pas mal de peur avec la venue de cet enfant.
Come mamma con un primo figlio hai moltissime cose che non sai, sei molto insicura, hai moltissime domande. Was verändert sich da alles und
On sait rien en fait quand on devient parent.
ma poi il momento arriva, du bist eine Nacht am Durchkämpfen und dann ist auf einen Schlag der Schmerz weg und alles ist vorbei und alles ist grün.
You look at this child the first time and and just this bonding happens. I would say that's the biggest moment.
La prima volta che l'ho messa al mio seno non funzionava tanto bene, poi avevo tantissimo latte, avevo un seno enorme. Je nachdem wie die Brust gebaut ist, bei mir war es ein bisschen kompliziert, weil es sehr flach war. Da musste es einfach lernen. Also man muss sich kennenlernen, es ist auch ein Kennenlernen, das Stillen.
Ma femme, en fait, elle voulait prendre plus de temps pour dormir la nuit. Alors, ce qu'on a fait, c'est qu'on a tiré son lait, et puis on l'a congelé, et puis après, je pouvais lui donner.
Ho allattato la mattina, la notte e la sera, e durante la giornata gli ho dato il biberon, sia mia mamma o il papà di mia figlia. Und für mich war es erstmal ein Problem und ich hatte auch eine Brustentzündung und es war super für mich abzupumpen und ihm trotzdem weiterhin Muttermilch geben zu können. Und da war ich sehr froh und dann war das nach einer Woche auch wieder geheilt und dann konnte ich ihn Gott sei Dank wieder ansetzen.
First I gave her the bottle and I was kind of lucky the other way round. So she took the breast afterwards as well, and that was great. So I could really switch, and I did it, 10 months.
oh, do it. Why do I do that? Thank you. So if you want to learn more about Medela products, you can always go onto the website www.medela.com.au. We have a circle solution, which is pumping, collecting, breast milk management, feeding and breast care. Everything's supported by evidence-based research. There's expertise, education. We offer a service, and we're continuing to develop. So has anyone got any questions? Sorry, does the baby get much wind? No, because the baby's regulating their own pattern, so they're sucking and swallowing as they're ready. So they're not sucking in air. Yeah. Yep.
She's not taking the bottle, the Calma bottle. What do I do?
Okay, so if she's not taking the Calma, maybe a suggestion is to express a little bit of breast milk and pop it around the tip of the teat.
I did that.
You've tried that? Just maybe if you even just get someone to observe you, a lactation consultant.
Okay.
And I mean, you can always call the Medela customer service and we'll give you some extra tips.
Sure.
Yeah.